Judith Persichilli began serving as the Commissioner of Health in August 2019. She has been alongside Governor Murphy, leading the state's response to the COVID-19 pandemic. Along with the response to this truly once-in-a-century public health emergency, under her leadership, the Department of Health works to protect and improve the health of New Jersey residents. The department's priorities include reducing health disparities, improving maternal health, addressing the overdose epidemic, and increasing access to healthcare. Prior to leading the department, Ms. Persichilli served as the acting chief executive officer of University Hospital in Newark. Ms. Persichilli was president emerita of CHE Trinity Health, the health ministry formed in May 2013 by the consolidation of Catholic Health East and Trinity Health of Livonia, Michigan. She previously served as interim president and CEO of CHE Trinity Health. And prior to this appointment, Ms. Persichilli was president and CEO of Catholic Health East. Ms. Persichilli joined Catholic Health East in 2003 as the executive vice president of the Mid-Atlantic Division. She was promoted to executive vice president of acute care for the system in 2008, and then to executive vice president and chief operating officer in December 2009, before assuming the role of CEO. Prior to joining CHE's system office, she served for 8 years as the CEO at St. Francis Medical Center in Trenton. Ms. Persichilli received her nursing diploma from the St. Francis Hospital School of Nursing, a Bachelor of Science in Nursing summa cum laude from Rutgers University, and a Master of Arts in Administration summa cum laude from Rider University. So, Commissioner, on behalf of the iPHD project and the governing board, we thank you for your support and leadership. And I'm delighted to welcome you and turn it over to you to deliver opening remarks.
Thank you so much, Rachel. It is exciting to join you today to mark the launch of the Integrated Population Health Data Project, iPHD. First, I'd like to thank Rutgers Center for State Health Policy and the iPHD governing board, led by our own state health departments, Rachel Hammond, for their leadership in moving this valuable project forward. The iPHD project is aimed at improving the health, safety, and security of New Jersey's residents and at improving efficiencies. This launch will now enable researchers from New Jersey's academic institutions and from medical schools affiliated with New Jersey's universities to begin submitting applications to access data available through the project to support approved research projects. The 4 identified research priorities, the opioid epidemic, maternal and infant health, social determinants of health, and COVID-19 and other public health emergencies, will examine the most immediate healthcare and health equity issues within our state. The opioid epidemic, maternal and infant health outcomes, and the social determinants of health have all been exacerbated by the pandemic. And understanding our journey through COVID-19 will help inform and further prepare us for future public health emergencies. Data-driven decision-making has been key to the state health department, and particularly as it applies to the COVID-19 pandemic. Since the pandemic began, all the department's policies and strategies have been developed with the goal of achieving equitable community protection. And through it all, we have been guided by data. For example, we know from the daily collection of hospitalization data from every acute care hospital in the state how COVID-19 is presenting in the form of severe disease. We know from our case surveillance data where hotspots are emerging that require a stepped up focus. We have used predictive modeling from the very early stages of the pandemic to assess the potential impact of COVID on hospitalizations, intensive care, and ventilator use, so that the state could provide guidance to hospitals as they planned for impending surges. In the spring of 2020, the department was using Penn Medicine's COVID-19 hospital impact model for epidemics, also known as the CHIME model, which was designed for hospitals to estimate how many patients would need hospitalization, intensive care, and ventilators. In parallel, we developed our own predictive model. We used it along with CHIME and the University of Washington's Institute for Health Metrics and Evaluation, or iHME model, to help inform hospitals throughout the pandemic. Comparing different models allowed us to test the validity of our own model. The result of this rigor was the accuracy of predictions our model has shown over time. Predictive modeling underscored the critical importance of preparing our hospital systems for expected surges, not only bed capacity, but workforce capacity as well. It also underscored the importance of increasing vaccination rates. As part of our efforts to ensure equity, we created a vulnerable populations plan focused on vaccination of high-risk individuals in long-term care, other congregate settings, seasonal farm workers, individuals experiencing homelessness, individuals with substance use disorders, individuals who are homebound, our tribal nations, people with disabilities, individuals over 65, and elderly residents in high-rise apartment complexes. We developed an equitable vaccine access methodology using the Social Vulnerability Index, including percent poverty, percent of communities of color, the COVID death rate per 100,000, and the percent without car ownership to focus our efforts and increase access and uptake of the vaccine. We recognize that the longstanding inequities that have contributed to health disparities disproportionately affecting racial and ethnic groups have also put underserved communities at increased risk for COVID-19. So last summer, we developed a county ambassador program in 11 counties that needed support to reach a minimum of 70% adult vaccination coverage. Key Department of Health staff were deployed into these counties to focus on COVID-19 vaccination efforts. They used a data-driven and collaborative approach with local leaders and community organizations to drive boots on the ground actions to increase vaccinations. We've used data to build awareness and education through discussions with over 1,000 interest groups, professional and civic associations, religious leaders, and elected officials. The result of these efforts has been one of the most successful vaccination programs in the nation. Research that uses appropriate and informed analysis of data can help provide insights on programs and policies to improve accessibility and availability of healthcare across issues throughout our state. Combining and collecting data from multiple sources has helped and continues to help inform decisions and all of our policy recommendations. Within the department, the centralized data and analytics hub also has been instrumental in New Jersey's COVID-19 vaccination efforts. It has provided data-driven insights to lead and innovate public health through faster and improved data-driven decision-making and democratizing access to public health data. Data collection and analysis that had been operating in separate silos highlighted the need for integrated data that can be cross-referenced to illuminate trends and needs. Tracking vaccinations among vulnerable and high-risk populations, especially by county, help focus delivery channels and improve health equity. Looking ahead, we are eager to see what researchers will step forward this summer through iPHD to apply New Jersey's data to enrich our understanding and responses in COVID-19 and beyond. The work of the iPHD project to focus on priority issues in population health will help identify insights and perspectives for public health initiatives that will ultimately help improve outcomes. So thank you again for undertaking this important work, and we look forward to all of your efforts. Thank you.